we now have several studies, and most of them within the last 1 year. Some actually go back to almost 10 years ago, where repeatedly many investigators have demonstrated, regardless of what assay they chose, is the fact that if you have ctDNA positivity post-operatively, so once you've had whatever curative intent surgery or multimodality therapy, depending on the study you see, once you're rendered cured, the half-life of ctDNA in circulation, is no more than a few days, maybe even hours. So it should clear up after, for sure, a few weeks after you've had your surgery. So a lot of the studies have looked at ctDNA positivity 2 to 4 weeks post-operatively, and at that point in time, you should not have any circulating tumor DNA. If you have, pretty much the survival curves in terms of recurrence is a wide split in terms of, for sure, if you were ctDNA positive, pretty much most, if not all the time, you had disease come back ideally within the first 2 years, as opposed to if you were ctDNA negative, there were still some patients where the disease came back, and that might be reflective of the low tumor volume, the location, or maybe the sensitivity of the assay, where you weren't able to pick up the ctDNA positivity. But there are not a whole lot of false positive in this particular situation, because this is not a marker like CA or CA19-9 where you have false positives.